Hello everyone, now let us discuss about 2023 ICD 10cm coding guidelines for chapter 15 part 2. In the current session, we will be discussing the selection of OB principal or first listed diagnosis. In the previous session, we have discussed the general rules for obstetric cases. In the current session, we will be focusing on selection of OB principal or first listed diagnosis. Now, coming to selection of OB principal or first listed diagnosis. It is again categorized into following guidelines. Guidelines regarding the routine outpatient prenatal visits. Next is supervision of high-risk pregnancy. The guidelines regarding the supervision of high-risk pregnancy. The next is episodes when no delivery occurs. Coding guidelines regarding the episodes when no delivery occurs. Next are coding guidelines regarding the episodes when the delivery occurs, and finally outcome of delivery. These points we will cover in this current session. Coming to the routine outpatient prenatal visits. For routine outpatient prenatal visits with no complications, when no complications are present, a code from the category Z34. For the routine outpatient prenatal visits when no complications are present, a code from the category Z34, that is nothing but encounter for supervision of normal pregnancy, should be used as the PDX or first listed diagnosis. And these codes should not be used in conjunction with chapter 15 codes. These codes should not be used in conjunction with O codes. Next, supervision of high-risk pregnancy. The codes from the category O09. Normal pregnancy is given by Z34, whereas supervision of high-risk pregnancy is given by the code category O09. Supervision of high-risk pregnancy are intended for use only during the prenatal period. And for complications during the labor or delivery episode as a result of high-risk pregnancy, for the complications during the labor or delivery episode as a result of high-risk pregnancy, assign the applicable complication codes from chapter 15. If there are no complications during the labor or delivery, assign the code O80, which is nothing but encounter for full term uncomplicated delivery. O09 should be given for the supervision of high-risk pregnancy, and they are intended to be used only during the prenatal period. The next is whenever for the complications during the labor or delivery as a result of high risk pregnancy. The patient is a high risk pregnancy case, and as a result of complications during labor and delivery, we need to code the appropriate O codes from the chapter 15, not O09. And if there are no complications during the labor and delivery, then you need to assign O80, which is nothing but encounter for full term uncomplicated delivery. Here you can see the overall supervision of pregnancy codes. For the encounter of supervision of normal pregnancy, the code category is Z34, whereas for the encounter for supervision of high risk pregnancy, the code category is O09. And Z34 is again subcategorized into Z34.0. This is further expandable. This is given for the supervision of first normal pregnancy. For the supervision of first normal pregnancy, you need to code Z34.0 subcategory. And for the supervision of other normal pregnancy, for example, second or third pregnancy, whenever the physician documents. For the supervision of other normal pregnancy, you need to code Z34.8 subcategory. And for normal pregnancy unspecified, for the supervision of normal pregnancy unspecified, the physician did not specify whether it is a prima gravida, first pregnancy or second pregnancy, then you need to code unspecified pregnancy, normal pregnancy code, that is Z34.9. Here are the overall codes for category Z34. The first one is Z34.0. It deals with encounter for supervision of normal first pregnancy. Normal first pregnancy. And Z34.00. Here the fifth character. The fifth character 0 indicates unspecified trimester. Whereas fifth character 1 indicates first trimester, fifth character 2 indicates second trimester, and fifth character 3 indicates third trimester. It is applicable for all the cases. So Z34.00 indicates encounter for supervision of normal first pregnancy unspecified trimester. 01 indicates Z34.01 indicates encounter for supervision of normal first pregnancy first trimester. Similarly, 02 is given for second trimester and 03 is given for third trimester. Next, Z34.8 series. Z34.8 series is given for encounter for supervision of other normal pregnancy. Not the first normal pregnancy, other normal pregnancy. 0 indicates unspecified trimester, 1 indicates first trimester, 2 indicates second trimester, 3 indicates third trimester. And finally, Z34.9, encounter for supervision of normal pregnancy unspecified. The physician did not specify which pregnancy it is, whether it is first, second, or etc. In that case, you need to code Z34.9, encounter for supervision of normal pregnancy unspecified. Here also, the fifth character 0 indicates unspecified trimester, fifth character 1 indicates first trimester, fifth character 2 indicates second trimester, and fifth character 3 indicates third trimester. These are the overall codes for encounter for supervision of normal pregnancy that come under the subcategory Z34. Now let us see an example. A 25-year-old pregnant woman presents for routine antenatal visit of first pregnancy. This is prima gravida. She is in her 20th week. So the appropriate code is Z34.02. Encounter for supervision of normal first pregnancy second trimester. Because second trimester starts from 14 weeks 0 days to 28 weeks. So Z34.2 is the appropriate code for this scenario. Now similarly, the O09 series, which deals with encounter for supervision of high-risk pregnancy, it is also subcategorized into following types. Here we are just seeing the subcategories. We are not discussing about the individual codes. Here also trimester code component is applicable. That point need to be remembered. So O09 series, O09.0 indicates supervision of pregnancy with history of infertility. This comes under encounter for supervision of high-risk pregnancy. The second case is supervision of pregnancy with history of ectopic pregnancy. It is given by the code series O09.1. All the codes are further expandable. O09.1 indicates supervision of pregnancy with history of ectopic pregnancy. The next is supervision of pregnancy with history of molar pregnancy. It is given by the code series O09.A. The next is supervision of pregnancy with other poor reproductive and obstetric history. This is given by the code series O09.2. The next is supervision of pregnancy with insufficient antenatal care. It is given by O09.3. The next is supervision of pregnancy with grand multiparity. It is given by the code series O09.4. The next is supervision of elderly prima gravida or multigravida. Elderly prima gravida indicates the patient must be 35 years or more at the time of delivery. Then it is considered as supervision of elderly prima gravida or multigravida. It is given by the code series O09.5. The next is supervision of young prima gravida or multigravida. It is given by the code O09.6. Young indicates the patient must be less than 16 years of age during the time of delivery. The next is supervision of high-risk pregnancy due to social problems. It is given by the code series O09.7. The next is supervision of other high-risk pregnancies given by the series O09.8. And finally, supervision of high-risk pregnancy unspecified given by the category O09.9. These are the various subcategories for the encounter of supervision of high-risk pregnancy. Now let us see the scenarios when a pregnancy is considered high risk. A pregnancy is considered high risk if the woman is less than 16 years old at the expected date of delivery, or 35 years or old at the expected date of delivery, if the woman is underweight or overweight or obese, pregnant using assisted reproductive technology, pregnant with twins, triplets and other multiples, if the woman is hypertensive, has diabetes, depression, HIV positive or other pre-existing health problems, if the woman is having a history of infertility, ectopic or molar pregnancies, history of having a prior complicated pregnancies or pregnancies resulting in preterm delivery or a child with a genetic problem, having a history of an in utero procedure during previous pregnancy, and finally having social problems that is a threat for pregnancy. These are the various scenarios when a pregnancy can be considered as high risk. And for routine prenatal outpatient visits for the patient with high risk pregnancies, a code from the category O09, that is nothing but supervision of high risk pregnancy, should be used as the first listed diagnosis. That is, it must be used as a PDX. And secondary chapter 15 codes may also be used in conjunction with these codes if it is appropriate. The PDX must be O09 series, and additionally you can use other codes from chapter 15 whenever appropriate as secondary diagnosis. Now let us see an example. A 42-year-old pregnant woman in her 30th week of pregnancy. 42 years old means here the age is more than 35 years. So 42-year-old pregnant woman in her 30th week of pregnancy comes to the clinic with complaints of decreased fetal movements. The ultrasound examination relieved bradycardia in fetus. What is the appropriate code for this scenario? So first PDX must be O09.523, which is nothing but supervision of elderly multigravida third trimester. 30th week indicates third trimester because third trimester starts from 28th week onwards till delivery. So O09.253 to indicate supervision of elderly multigravida third trimester. Next O36.833. This is a code from chapter 15. Maternal care for abnormalities of fetal heart rate or rhythm. Here there is an abnormality in the fetal heart rate. Fetus is having bradycardia. So O36.833 indicates maternal care for abnormalities of fetal heart rate or rhythm third trimester. Finally, Z3A series, Z3A.30 to indicates 30 weeks of gestation of pregnancy. These are the appropriate codes for this scenario. Now coming to the next guideline, episodes when no delivery occurs. Coding guidelines for encounters when no delivery occurs. In episodes when no delivery occurs, the principal diagnosis should correspond to the principal complication of pregnancy which necessitated the encounter. Principal complication will be the PDX, which is the reason for encounter. Should more than one complication exist, if there are more than one complications which necessitated the visit, all of which are treated or monitored, any of the complication codes can be sequenced first. You need to code all the complications that have been treated or monitored. Now coming to scenarios when a delivery occurs. When an obstetric patient is admitted and delivers during the admission, the condition that prompted the admission, that is the reason for visit, should be sequenced as PDX. In most of the cases, reason for visit will be the PDX. And if multiple conditions prompted the admission, if more than one condition prompted the admission, sequence the most related to the delivery. Sequence the condition that is most related to the delivery as the PDX. And a code from any complication of delivery should be assigned as an additional diagnosis. Next case, in cases of cesarean delivery, If the patient was admitted with a condition, in the case of cesarean delivery, if the patient was admitted with a condition that resulted in the performance of the cesarean procedure, that condition which resulted in the performance of C-section should be selected as the PDX. And if the reason for the admission was unrelated, the next scenario is if the reason for admission was unrelated to the condition resulting in the C-section, the condition that is related to the reason for admission should be selected as the PDX. Pregnant woman got admitted for some other condition and that resulted in a C-section. You need to code that unrelated condition only as the PDX because that is the reason for visit. Now finally coming to outcome of delivery. A code from the category Z37. Outcome of delivery should be included on every maternal record when the delivery has occurred. Whenever the delivery has occurred, a code from the subcategory Z37 outcome of delivery should be included on the maternal record. These codes are not to be used on the subsequent records or on the newborn records. Z37 code should not be used on the subsequent records or on the newborn record. And this category is intended for use as an additional code. It must be used as an additional code to identify the outcome of delivery on the mother's record. It is not to be used on the newborn record. We will discuss in detail about the outcome of delivery when we discuss the O80 series. Here we will just go through what are all the codes of Z37 subcategory. Here you can see this is the complete list of Z37. Z37.0 indicates single live birth. Z37.1 indicates single stillbirth. Z37.2 indicates twins, both live born. Z37.3 indicates twins, one live born and the other is stillborn. Z37.4 indicates twins, both stillborn. Z37.50 indicates multiple births, unspecified, all live born. Next, Z37.51 indicates triplets, all live born. Z37.52 indicates quadruplets, all live born. Z37.53 indicates quintuplets, all live born. Z37.54 indicates sextuplets, all live born. Z37.59 indicates other multiple births, all live born. Next, Z37.60 indicates multiple births, unspecified, some live born, some fetus are stillborn. Z37.16 indicates triplets, some live born. Z37.62 indicates quadruplets, some live born. Z37.63 indicates quintuplets, some live born. And Z37.64 indicates sextuplets, some live born. Z37.69 indicates other multiple births, some live born. Z37.7 indicates other multiple births, all stillborn. Finally, Z37.9 indicates outcome of delivery unspecified. And you need to code this Z37.9 for multiple birth NOS and a single birth NOS. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.